Welcome to Profiles on Lake Central TV. I'm Marc Robertz. Traditionally, Profiles features individuals, organizations, sometimes community events. Today, we feature the North Lake Hospital District, something that you're going to take a look at on the November ballot. Now, before we get started, let's clear up a few things. Red Apples Media, which produces this program, has an existing business relationship with each of the three entities we'll introduce you to today. Production for this program has been paid for by Leesburg Hospital and by Florida Hospital Waterman. However, none of the questions have been provided to our panelists prior to this. We retained all of the editorial control of this program. With that said, let's welcome our panel. Anita Young from Florida Hospital Waterman, John Cherry from LifeStream Behavioral Center, and Don Henderson from Leesburg Hospital. Welcome, I appreciate you all being here. So let's start sort of at the top. Anita, give us a little bit of the history and the background of the North Lake Hospital District.
Certainly. In the 1950s, we had great residents in our community who really wanted to assure that healthcare was provided for all residents in the North Lake area. And so I'll primarily talk about the east side because the west side was a little bit different. Their organization developed and their request for tax district funding came a little later than that. But in the mid-1950s, several of our individuals within our community came together and went to Tallahassee and asked for additional funding for Lake County, and that started the North Lake County Hospital District. And then on the west side, a little bit later in the 60s, then the district on the west side was formed. And so this is not a new district. It's been with us for many years and has continued to support healthcare needs of the indigent in our community.
So geographically, you're talking about, we're sort of the dividing line because South Lake has its own hospital district.
That is correct. So it's only on the northeast and northwest sides of Lake County. So as you just mentioned, as you head south into Claremont, that's a different taxing district. It is separate. It is completely different than the North Lake County district.
But this is, as you said, this is nothing new. This has been around for almost 60 years now.
That is correct.
Correct. Okay. John, tell us how the North Lake Hospital District Board is comprised. Who sits on it? How do they get there?
There are 6 members that sit on the taxing authority. They are elected by the citizens of North Lake County. So I believe that of the 6 positions, 5 are currently filled, and the 1 vacancy is awaiting the governor's appointment to fill out the remainder of the term. So these individuals are responsible for the administration of the taxing district, responsible for setting the tax rates and for determining how much of an allocation each of the primary care providers or the hospitals in North Lake are allocated.
And the members of the board are also residents of the district?
The members have to be residents of the district, 3 on the east side of the district and 3 on the west side.
Anita, speaking of residency, tell us what qualifies an individual to be eligible to be able to have their medical services refunded or rebated or applied for.
Individuals within Lake County, within the North Lake County District, have to be residents of the county and in the particular district area for a minimum of 6 months. In addition, financially, they have to qualify at 200% or less of the federal poverty guidelines. And then there are other qualifying factors. They cannot have any insurance whatsoever. And the important part for those viewers that are listening to this is that we are serving the actual qualified population of indigents within our community by these qualifying factors.
Do they know that they've been served by these funds? Are they identified in any way, shape, or form, or they just get treated and they have no idea that their services were covered through the North Lake District funds?
They do not individually know. They do know that their taxes or the taxes within the community support not only the clinics but the hospitals in the North Lake District, but they do not know individually.
Don, who is covered? In other words, which medical entities are covered as part of the hospital district?
That's a good question. If you look at the composition of our service area, fortunately a large number of folks do have insurance. I would say probably the #1 insurance in the area is Medicare because of all the retirees we have fortunate enough to have in our area. Right behind them it would be commercially insured folks. Most folks when they're of working age get their health care coverage through their employer or in some cases the governmental entities that are so important here in the Lake County area. Following that, a smaller percentage of folks get Medicaid, which is a federal program that only deals with folks that have income very low at the poverty level or below the poverty level, which is less than $25,000 for a family of 4, which is quite a low level. But because of the types of industries that we do have here in Florida, there are a large number of working poor that have no coverage. And that's what the hospital district funds go for, is for folks that have medical needs. And as you know, medical bills can go up very rapidly. Even if you have a relatively small incident, pharmaceutical costs are astronomical, hospital costs are high, costs of primary care and specialty care. So the great thing we have in Lake County is that that's all knit together right now in a comprehensive way, but it's all underpinned by the hospital district receipts.
And which medical facilities participate within the district? Who receives some of those funds?
The first dollar off the top in the last few years has gone to a series of what they call free clinics, which are really clinics geared at the lower income or indigent population, those who have no other form of insurance. So those are clinics that are run by, there are 2 clinics sponsored by each of the hospitals. One is sponsored by Waterman, another sponsored by Leesburg Regional Medical Center. But beyond that, there's another religious clinic that's over in Eustis that's sponsored by a church sponsorship, and then I believe a couple of the clinics are sponsored by LifeStream. So there's 5 clinics altogether. That's the first dollar coverage, and then usually what happens after that is anything that's not going for their resources goes, it's split equally, and half is given to each of the 2 major hospitals in the area.
And then LifeStream would be the other recipient.
Right.
We are for approximately 4 hospital beds that have no other funding source.
So the numbers that I read was somewhere in the neighborhood of a little over $8 million was raised in 2015. And you kind of punctuated it was generally split evenly among the 2 hospitals, about $3 million, give or take each, and the rest was split between LifeStream and the clinics within the area. What is the impact, Anita, what is the impact to the facilities in having the ability to have these funds available to them?
So I'll start with the clinic. The clinic that Florida Hospital Waterman supports is the Community Primary Health Clinic in Eustis. So the impact to that particular facility is that we're able to see these patients that would really only have the emergency room as their primary access. They can go to a clinic environment and have a medical home where they actually can see a physician or a mid-level provider and begin to have regular routine visits just like the rest of the community have when they're able to pay. And they have the opportunity to really get their healthcare diagnosed, they can stabilize their disease process, they can get their medications, and it allows us as a healthcare system to also supplement that clinic. But the tax district dollars then do help us to be able to reach more people within the clinic environment. And that's the lowest cost of care, not only for our whole community, but there's really no cost to those individuals who come to the clinic. But we are able then to minimize the continuation of their disease process. Because what happens is if we can't care for them in the clinic environment, then we care for them in the hospital environment. Or if there's an emergency, we care for them in the emergency room and then through the hospital. But that care is so much more expensive. And so what we're trying to do is take those funds that are given to us by the district, utilize them to impact care and impact the lives of the individuals that we see in the clinic, and then also to help supplement to cover some of the costs that we incur at the hospital level as well. But I think it's important to kind of understand, the tax district dollars cover about 20% of what we incur as an organization in the cost to care for the indigent. So the hospitals are already picking up 80% of that. But really, the impact of 20% is huge, and we're just so appreciative of the fact that our taxpayers are supporting the care of all in our community.
So that explains how the money impacts the medical facilities. Let's look at it from the other standpoint. What is the financial impact to the taxpayer? How is it calculated? How is it determined? What is the annual impact, if you will, to the taxpayer?
So the way the district is set up is that it's a maximum of $1 mil can be levied by the actual tax district board, and each year so far they have levied the full $1 mil. What that means to the average tax payer, and I will tell you I brought my tax bill with me so I would have accurate information, it's anywhere from $10 to $12 a month for the taxpayer. So if you look at it in comparison to your cell phone bill, I pay more for cell phone taxes than I do for my indigent care tax that I pay to the district. So for me, it's, with homestead exemption here in Lake County, it's about $12 a month. Without homestead exemption, it's about $16, $17 a month. So that is the actual impact of how much it's costing the taxpayer.
So in the grand scheme of the taxable value of a home, average taxable value in 2015 within this part of the county was about $140,000. You're basically talking about $10 for every 100,000?
That's correct.
Okay. I'm sorry, for every 1,000, $10
Right.
for every 1,000.
Yes, correct.
Okay.
Correct.
And so you're suggesting $10 to $12 when
It's kind of the
spread out over the
average.
course of the year.
That is correct.
Gotcha.
And the impact also, I would like to mention to the individual that's paying that tax, we want to make sure that we're caring, at least from my philosophical standpoint, want to make sure we're caring for our entire community. And so I, as a tax-paying citizen, want to make sure that when I go to the emergency department that I'm seen, but everyone else is seen as well. So we don't turn people away, but if we can find the place that we can see them in the least expensive way, that benefits not only the individual because they see a doctor more routinely or a mid-level provider, but it also impacts the healthcare system and those of us who access care in a traditional way. So it is a benefit to all.
John and Anita talked about the impact on the emergency room. You have a different situation over at LifeStream. What is the impact on you and your ability to serve patients, clients as they come through your doors?
Well, as Anita described, we receive a portion of the funding for primary care services for the populations that we serve. There's been a tremendous disparity over the years in this population getting primary care services, so much so that the average individual with serious mental illness dies 25 years before we do, the normal population. And so it's very, very important to get primary care to this population so that they may have a shot at having a decent, long life just as we do. So that's very important. Also, the care in the hospital. We have a tremendous indigent care load at our psychiatric hospital. 62 beds, 25 of those beds are for indigent patients every day. The state helps us with some of that funding. The hospital taxing district helps, but above and beyond that, there are an additional 5 beds per day that are paid for by no one. So that is the care that we provide that is free of service to the community. But the hospital taxing district is essential with the dollars that they fund. If not, it would put the hospital in a precarious position.
Don, local dollars stay local?
They do, and the great thing about this service is that it goes directly dollar for dollar. In fact, we are audited on every single one of the expenditures that are made on our behalf, and we have to prove to accountants that have been hired by the hospital district that we're actually reimbursed at the Medicare rate, which is a fairly low rate of reimbursement. But dollar for dollar, every single claim that we submit has to be verified and it's audited. So the dollars stay local. The purchasing of the service is going at a very reasonable rate.
Excellent. We're going to step away for a quick break. We are talking about the North Lake Hospital District. When we come back, we're going to talk about some of the perceptions that have been created, and we'll see if we can dispel those a little bit. You're watching Profiles on Lake Sumter TV. We'll be right back. Welcome back to Profiles on Lake Sumter TV. We're talking about the North Lake Hospital District, an item that local voters will have a chance to vote on in November on the November 8th ballot. We were talking about sort of the history. We've talked about sort of how the funds are created, how the funds are divided up. Back in 2012, the district took a little bit of a hit, challenged a little bit on transparency. And I'm curious what kind of steps have been taken since then to help with, you mentioned there's an audit process. How are the funds distributed? In other words, what is the process to determine who gets what money, and what steps have been taken to improve the transparency? Don, you want to start with that?
Sure. Well, every dollar is accounted for in a very specific way, and as I mentioned previously, The first dollar always goes to the clinics because the tax district board, as well as we, understand that primary care is really the most important area. So we try to maximize the amount of dollars that go to the private clinics or the clinics that are doing this type of work. Then once that is taken care of, I believe there's an allocation for the LifeStream hospital and for the other hospitals. One thing I want to mention for the record is that although we're thrilled to receive a $3 million subsidy from the North Lake District, that only represents a fraction of the actual charity cost that we endure every year. The $3 million compares to actually a cost of about $20 million to provide the overall charity care that we provide for local residents.
Is that just for your hospital?
That's just for Leesburg Regional. So, and a similar number, I think, at Waterman as well.
Right, Anita mentioned somewhere there, that covers about 20%.
That's correct.
Okay.
The other point I wanted to make is that, you know, there's no such thing as really as free care, because if the low-income residents of our area have catastrophic illness, as Anita mentioned, they're coming to the emergency room, and that care has got to be paid for by somebody. And you can't really pass that care along to the government because our government rates are fixed. So it's really the commercial side that those costs have to get shifted to. And I would argue that in the community, paying a Medicare rate for indigent care is far superior than having the hospitals have to otherwise pass those costs through to the other folks that provide insurance in the community.
So to kind of maybe put it in layman terms, as I understand, the hospitals are basically submitting paperwork almost as if they were submitting to Medicare, Medicaid, insurance company.
A claim.
And essentially getting reimbursed on that claim by the board that's managing the money. Accurate?
Correct.
Okay, just wanted to check that. What type of services, so this is strictly towards care. I know the questions come up, what type of services, for instance, are not covered by this money? I mean, no one's out golfing and going off on vacations with this money.
Right.
So what are some of the things, help us understand specifically what it's used for and maybe some examples of what it cannot be used for.
Well, one of the reasons this is unique is that the charitable clinics that do this type of work, they basically have an all-volunteer workforce. In fact, the total cost of care is probably far greater than the actual amount of money that's coming to the charitable clinics. The reason for that is under Florida state law, you have what's called sovereign immunity. So when the doctors and nurses who volunteer for these clinics work there, they're given a pass on the liability. So specialists volunteer there all the time. We have probably 20 different specialists that volunteer at our community medical center here in Leesburg, along with volunteer nurses and other volunteers. So they come and volunteer and provide specialty consultation that would not be available to these low-income citizens otherwise. Beyond that, the main focus is primary care. And everybody knows that primary care is superior to catastrophic care. Anybody that's ever had an illness, if you wait, you're certainly going to have extra pain and suffering, to say nothing of higher costs. So primary care is the main focus of these entities as well.
Anita, there's been, I think when you talk about indigent care, it creates almost this caricature. But in fact, there are some pretty compelling stories of people who just were in the wrong place at the wrong time, maybe had just recently been laid off from work and got hit with some sort of medical event. What would you like people to understand about what that, my word, not yours, that pool of patients, what do they really look like?
Sure, I'd be pleased to share because I think many of our residents would be surprised. The vast majority of the patients that we see in the community clinic setting initially are working folks. They want to provide for their family, and they have provided for their families in many instances for many years. And then because of a certain, whether it's a catastrophic illness or whether something happened in their family, or maybe possibly it's just that they were laid off from work, or the particular business that they were a part of is no longer in existence for a variety of reasons, economic reasons. And so they're faced for the first time, many situations, they're very close to Medicare age. They're faced for the first time in their entire adult working life with no insurance. And wow, what do I do? I've always paid for my insurance. I've always had good physician care. I've always had great hospital care. Now, what do I do? And we find that that's really the profile of the individual that we see in the clinic setting. And so, you know, I think we as individuals oftentimes look for the worst instead of the best in our community. But actually what we see at the clinic are people who have had a situation and yet they want to get back to being a working, productive citizen. And that's why we really want to help them. We want to help them get back to being a productive citizen in our community and able to then afford health care or afford insurance moving forward.
Part of what you're describing seems to me like, isn't that part of what the Affordable Care Act was supposed to address? The individuals who could not afford their own health care. Why is that not the case?
It has for some. It has been for some. And I'll let you all jump in here as well, but because Florida didn't participate in the expansion of Medicaid, we still see that there's a gap. So there are individuals that we see at our community primary health clinic that don't even qualify to actually get on the exchange and to purchase insurance. There are some that are totally unable to afford the insurance that's on the exchange. So I think, again, there was this idea that it would cover everyone, and there are still gaps of individuals who do not have insurance within our community.
Yeah, I would say that the latest study on this from the University of Florida showed that there's about 45,000 people in the Lake County area. Now that includes North and South Lake, so you'd have to adjust that for the population, but there are literally tens of thousands of families and people that have no insurance, that have no recourse other than the hospital emergency rooms. And the question would be, well, what if this went away? And at the end of the day, it would be pain and suffering of our fellow citizens, but beyond that, it would be a catastrophic illness that then burdens the health system as well, because it costs just as much to do heart surgery on an indigent patient as it does to do on an insured patient. And as this goes along, you know, if you don't get the preventative care, then you don't get the cardiac treatments, then you don't get the preventative cardiac medications that are necessary, and then inevitably the catastrophic result is costs multiple times more than just the primary care that you could have given for a relatively low cost.
And as Anita mentioned, the Affordable Care Act has not been passed in Florida. The estimates are that there are approximately 1 million Floridians who would be covered, who would have health insurance if the Affordable Care Act was enacted in Florida. And so that would help tremendously. It wouldn't cover everyone still. There would be individuals that in various categories that did not have coverage, but 1 million people in Florida is 5% of the population. It would make a huge difference if they were covered.
John, I often hear in conversations about this particular issue the fact that all three of yours and certainly the community clinics are all not-for-profits. Why should not-for-profits be receiving these funds? Is it almost a form of double dipping, if you will? How would you respond to that?
Well, it's not double dipping, and not-for-profit is a misnomer. The entities that we are responsible for and many millions of other entities throughout the country that are called not-for-profits are actually tax-exempt organizations. We provide a mission and a purpose that is not addressed by others in our community, and therefore we are allowed to have a tax exemption for that. In return for that, we provide, as Don has indicated, millions of dollars worth of services that aren't reimbursed. So while we are not-for-profit, as the nuns used to say who run hospitals, no mission, no margin, no mission. And that is so true. So even not-for-profits have to have small margins, which is what we operate under. And we use the dollars that are generated in excess of expenses each year in order to provide more services to the community, better facilities, and better care for individuals in the future.
Both Don and Anita, you both mentioned somewhere in the neighborhood of about 20% is covered, 80% is not. There are those that would say, you know what, just cover the other 20% as well. It's not like your doors are going to shut down. You know, you're not going to close the hospital because you have to absorb that additional 20%. How much of a difference does it really make? You want to kind of respond to that initially?
Sure. I can tell you over the, if you take 3 million, 3.2 million, you multiply that out over, you know, a 10-year period, which is the referendum period, you know, you're talking about an influx of 32 million. So when you think about it in those terms, and you think about when you do reinvest back into hospital services or into clinic services, you're providing care for a much longer period of time than 10 years. So those funds help us to make sure that we are providing the best for our entire community, no matter what your socioeconomic status is. And so it's vital to our organizations.
And I would say, you know, we're governed by a volunteer group of local citizens. Leesburg Regional has a board of trustees, and you know, the main goal here is to provide care for everyone. And the question I think I have is, without the tax district, what level of care can we provide? Because we at Leesburg Regional, we provide a very advanced level of services. We have cardiac surgery, we have neurosurgery, and I think that's really, you know, without being too threatening or any too draconian, that's the type of service that I think that we have to take a hard look at. Can we afford to do everything that we're doing now? Even though our trustees think it's in the community's best need, we'll have to take a hard look at all the range of services that we currently provide.
But to be clear, the money that's provided by the hospital district does not necessarily go towards the purchasing of those types of equipment for those services.
It goes for indigent care, but the subsidy that it provides to indigent care helps free up resources for these other services that I just mentioned.
Excellent. So we're going to wrap up. John, if there was one takeaway that you'd want viewers to understand about this referendum issue, what's the final takeaway that you'd like to express, probably specifically relevant to LifeStream?
Hospitals are the fire stations of the healthcare system. We all want to support the establishment of fire services, and the county does that for us, and we pay for that through our taxes. Hospitals, if the emergency rooms were not there, then what would we do when we face a crisis in our lives, in anyone's lives? I've had to utilize emergency rooms 4 times in my life. 3 were life-threatening. If that emergency room hadn't been there with very competent staff and the hospital bed that I was in thereafter, I might not have made it. And that's the importance of having a strong healthcare system, which includes world-class hospitals that are there to provide care for us when we need it.
Thanks, John. Thanks to all of you. On November 8th, North Lake County voters will have an opportunity to vote on this referendum. You can get additional information, if you'd like, at healthylakecounty.org. We hope that this has provided you some background to help you make an intelligent decision when you do step into the voting booth. In the meantime, on behalf of all of us at Lake Sumter TV, we appreciate and thank you for watching Profiles. Featured profiles from this episode can also be found on our website, lakesumtertv.com, and on our YouTube channel. And if you're interested in having your business, organization, or event profiled in an upcoming episode, send an email to lakesumtertv@gmail.com. Profiles is a production of Red Apples Media in partnership with Lake Sumter State College.